Is everybody here? Raise your hand if you're not. So this is a wonderful day. I want to remind you that lots of terrible things have happened over the years. The shooting at Virginia Tech. I am the past president of the National Association of County Behavioral Health and Developmental Disabilities Directors. So I have personal knowledge of many of these terrible things that have happened with people with severe mental illness who weren't taken to treatment and were out of control and did these horrific things. First, I want to reinforce that if you have a mental illness, you're more likely to be the victim of a violent crime rather than the perpetrator of a violent crime. Also, I want to remind everybody that 25% of everybody in the United States, in fact, everybody in the world, has a diagnosable mental illness. So it's very common. The problem is usually it goes undiagnosed. So people tend to self-medicate with alcohol and drugs, and so they have family problems, they have job problems, they have lifestyle problems that make it difficult. So Virginia Tech, the shooting of the Congresswoman, the shooting at the Naval Yard recently, the drive-by shooting in California, the young man that shot up the theater in Aurora, Colorado. In fact, I was in Aurora, Arapahoe County, a year after the shooting, and one of the county commissioners asked me to come and talk to the commissioners of the community about the things that we're doing here to train law enforcement officers and having alternatives to get people to treatment. And I was visiting with the sheriff after my presentation, and he said, Leon, he said, everybody knew that young man was sick. He was going to be a brain scientist, which meant he probably knew he had a problem. He was trying to discover what his own problem was before anybody else knew. He got out of control. His roommates moved out because they were scared of him. He dropped out of school. He dyed his hair orange. The psychiatrist who was treating him was terrified of him. She was scared of him. And the sheriff told me, when I called his mother that night after the shooting, she said, yeah, you got the right guy. So even his mother knew. The problem is nobody knows what to do. They know that their loved one, their roommate, their student, their friend have these problems. They just don't know what to do about it. So we're rolling out a mental health app today that is very easy to use. It's got a lot of different features. We think this is a way to educate our community so we can get people help when they get fragile before they hurt themselves or somebody else. We're fortunate here in Bexar County that both our sheriff and our police chief are requiring all their law enforcement officers to go through the 40-hour crisis intervention training. So these officers are trained to recognize the signs and symptoms of mental illness. And so when they encounter somebody, rather than use their command voice and command presence, they're de-escalating the situation, and they're taking the person to get help. So if people know where to go and what to do, then we can get people help in treatment. And treatment works, by the way, before they hurt themselves or somebody else. So Allison Greer and Christy Mond are kind of the innovators that put this project together. After I met with the sheriff in Aurora, I kind of came up with the idea with apps because that's how we get information, right? So we want to roll this app out. We want to take it to PTAs. We want to take it to schools. We want to take it to business and industry, teach them how to use it. It's a very interesting app. There's lots of stigma busters there, so it's not just the negative parts of having a mental illness. So enjoy. Try to be back here about 12:45 because we've got two videos we're going to show. One's called Roll Call, and the other one's a film called by Brave New Films about our diversion program here in Bexar County. And I know we have some law enforcement officers in the room that are featured in both those films. So thank you.
John 911, what's the location of the emergency?
Sandy Hook School. I think there's somebody shooting in here. Sandy Hook School.
Okay, what makes you think that?
Because somebody's got his gun. I saw a glimpse of somebody that's running down the hallway.
Inside that theater, it appears to be chaotic. You can hear some of that background noise. You can kind of see people scurrying out of the theater. We don't know exactly when this was taken in relation to what happened in theaters 8 and 9 there at the Century 16 movie theater, but you can get a visual sense now of the chaos that was happening inside that theater moments after this lone gunman opened fire.
I think Sandy Hook changed a lot of things for me and other parents just like me. All of a sudden there's this fear of taking your kids to the one place they've always been safe. It became real for me that day, knowing that there's people out there that are really sick and they don't know right from wrong when they're in a crisis. I would absolutely download this mobile app, and I would encourage other parents and teachers to do the same. It's just a great tool to have at your fingertips if you're ever in doubt about someone you know, someone your kids know, that they're displaying signs of distress.
There's a lot of stuff that people don't know about. Like, I hear my friends every day say they're getting pressured by going to college, doing the right thing, and just trying to fit in. Then there's some other stuff that I see, like bullying. High school can be hard sometimes. I like this mobile app because it makes you feel not alone, and it's neat because anybody can use it and learn about other people's issues. And you can learn about famous people and how they're going through their issues. And so if they can do it, so can you.
I work in a building with 1,600 people, and there's no way for me to know everybody. My coworkers, even them, I don't know everything about them. I don't know what goes on in their lives at home, and I don't know if they're bringing that stuff back to work and how it affects them. After the Navy Yard shooting and the shooting of Congresswoman Giffords, often I wonder, could that happen here? Could that happen in our building? And if so, what would I do? It's pretty scary. I think this mobile app is an excellent resource, especially for people like me, who work in a building alongside 1,600 other people. But I think it's timely too, given what's been happening in our country over the last few years. You can go to this app, find out if there's cause for concern, and if you think there is, you can learn what to do about it and where to go for help.
You know, I live with a mental disorder, but it's not something that I have to deal with day to day anymore. But I still have bad days. When my mother died, I had a bad month. But it's not a bad thing. It's just reality. And it's okay. I think this mobile app is very relevant because it's a place that I can go just to get my thoughts out and see other people's. Get some resources. My friends and family can't always be there. I hope everybody downloads this app. Maybe then people can start learning about mental illness and not just being afraid of it, but coming to accept it. It's just life.
My name is Chris Balthrop, and I am a wife, a daughter, a friend, and a neighbor. But first and foremost, I am a mom, and I need to know where to go to get help.
My name is Gabriel. I'm a student, athlete, and a friend. We all need to know where to go for help.
My name is Byron Gibson. I'm an employee, coworker, and friend, and I need to know where to go for help.
My name is Aston Jones. I'm a mom, I'm a friend, I'm soon to be married, and I'm a certified mental health care support specialist, which is a profession. I think we all need to know about mental illness, and a large part of that is just knowing where to go for help.
Okay, we have people coming, okay?
Good morning. 1 in 4 of us will suffer from some form of mental illness in our lifetimes. But it's an odd paradox that our society, which talks about everything openly, doesn't talk about mental illness. And 60% of those who have a mental illness don't seek treatment, either out of fear or lack of information. And they're left to suffer alone, or worse, as Dr. Vanderscheid mentioned, they self-medicate with drugs and alcohol to cope. Well, today we want to change that. We want to welcome you. This is the Center for Healthcare Services mobile app. It's called Mental Health and You, and we would like to take you through some of the features. We think that this is a very innovative way to reach people, to teach them about the signs and symptoms of mental illness, and link them to resources they need, and help them maneuver through a mental health crisis. So, let's get rolling if we will. If you'll notice, the initials here are MHU. We wanted this app to do 2 things. First and foremost, we wanted it to be Mental Health University. We wanted it to be a place where you could go and learn about the signs and symptoms of mental illness. We also wanted to give people a place to go when there was a crisis. You've heard over and over through the course of the morning, everybody knew somebody who was sick, but nobody knew what to do. Well, this app is going to tell you and show you what to do in a crisis. So I'm going to spend the next few minutes going through the wireframes. This is not a comprehensive discussion. I hope that you will download the app. It is live on the App Store. But I just want to give you a general feel for what the app looks like and what it's designed to do. All right, so the first part of the app, this is Mental Health University. We've got 3 different sections here. First and foremost, we have the signs and symptoms of mental illness. We talk about the top 7 major disorders that we treat. We also included ADD and ADHD and eating disorders because those are so prevalent in our society. Second of all, we wanted to dispel the myths about mental illness. There's so much fear and stigma surrounding mental illness. We wanted to tell people what's true and what's not true. So we have a section called Did You Know? At the bottom of that, you will see scrolling factoids that go through. First and foremost, we like to focus on the positive. People who do seek treatment get better. But you'll see a lot of different factoids that are circulating through that. Finally, in the last part of Mental Health University, we have a resource center. We have local and national resources. They are live links to websites like NAMI, the San Antonio Coalition for Veterans and Families, and a whole host of other national resources. At the bottom of every page, too, is a Get Help Now button. It takes you directly to the crisis hotline. We'll talk about that a little bit later. But every single place on this mobile app has somewhere that takes you to somebody who can help. Okay, so I mentioned that the first part of this is signs and symptoms. We have a descriptive paragraph and just some general information about each of the 7 major disorders. I'm too nervous to name them off the top of my head, but it's anxiety and bipolar disorder, depression, schizophrenia, PTSD. So we have a lot of information about each of these disorders. What we also thought was important was to talk to people about what they needed to do if they saw certain things. So we included a section called Should I Be Worried? If you see these 3 or 4 things, get help. You've got some warning signs here, and we thought it was important for people to to know those. So each of the 7 disorders and the 2 that we added have a section called Should I Be Worried? So if you see these things, you want to get help. All right, so we talked also about Did You Know? We wanted people to know about other famous people who suffered from some mental disorder. Some prevailed, some did not, but we wanted to give people an idea of how common this is and how a lot of people, the majority of these people, go on to live independent and productive lives. Obviously, Vincent van Gogh was not one of them, but we have Abe Lincoln and Winston Churchill, Lois Lane, Margot Kidder had depression, Catherine Zeta-Jones, we have information on her, and Michael Phelps, the Olympic swimmer, had ADD, ADHD. So we've got information on a lot of famous people and what they suffered from. So included in the Did You Know section are also a listing of movies, famous movies, and I know you probably can name a whole bunch of them. One Flew Over the Cuckoo's Nest is the first one I remember back in the 70s. That's how old I am. But up until A Beautiful Mind and last year, very, very popular, Silver Linings Playbook. So we talk about a lot of movies and what their meanings were and what they were portraying. We also have a section on stigma busters, and I'll show you a little bit later some of the, we actually had fun doing this one because there's so much stigma surrounding mental illness, there's so much misinformation, and we want people to know what is reality and what's the fact. We also have factoids and FAQs. We'll go over those a little bit as well. So in our stigma busters, we thought it would be helpful for everybody to see some common sayings. These are people, I know I've said these things myself. My favorite one, because I love to cook, how about I cook you a good meal? That'll make things better. All right, so let's move away from the Mental Health University part and let's focus on the crisis part of the app. We thought it was important not just to put a panic button, if you will, or a crisis button on the phone, but also to explain to people why it was they were calling and what was going to happen when they did call. So all of our calls are answered by a hotline, and they're answered by qualified mental health professionals. They're trained in crisis intervention, they're trained in assessment, and they will help you diffuse a situation. If necessary, they'll dispatch our crisis intervention team, our mobile crisis outreach team. You heard Leon mention 95% of our police department, and I think almost close to that in the Bexar County Sheriff's Office, are trained in crisis intervention. So when they get to your house, they're not going to use their command voice or their command presence. They're not going to shoot your loved one. They're going to diffuse the situation and, if need be, take your loved one to a crisis center. We also thought it was important for life-threatening emergencies to have another button that would go directly to the police. So for harm to others, harm to self, and in active shooter situations, you press 911 and you go directly to local dispatch. So the Resource Center, we wanted to provide you with information on a host of different resources. So we've got adult programs for children, links for veterans. You see a veteran's call-in number. We have family prevention services. Everything that you can imagine is on this app, and the live links will take you there if you need more information. So here is a listing of the national resources. I do want to tell you there was some coding error with Apple. I told Leon the flux capacitor was broken. We're not sure what happened, but the links are not quite operational. Apple has promised us they'll have it repaired in the next 7 days, they promise. Some of the links work, some of them don't. Again, when we pushed it live, it worked. We're not sure what happened, and we apologize for that. But we are working to fix it, and Apple promises that they're working on it as quickly as possible. So that's all I've got. Again, we want to thank you for being here. I've got some special introductions that I need to make. As you can imagine, this was a Herculean effort. It took us a year to get this off the ground. First and foremost, I'd like to recognize my team, and I think they're both outside. Christy Mott and Margot Tovar. I think they're both outside fielding media requests. Thank you, Margot. Dr. Milam, Dr. Camus Milam, if you will please stand up. Dr. Milam is our Executive Director of Medical Services, and she blessed all of the information we put out. Thank you, Dr. Milam. Peter Bechet and Joe Rudy Rodriguez from Boss Creative, if you will please stand up. They are the brainchild. They did the logo and the design, and we are so happy to have you. Thank you very much for your efforts. Leon Evans, I think he stepped out to go make an introduction. We hope that you will get as much out of this app as we do. We think it is our job at the Center for Healthcare Services to help reduce stigma in the community. We hope this app does that for you. We hope that you will tell all your friends and family about it. It is free to download. And I think that's all I have. I'll be happy to take questions. Yes, sir.
I got it on the phone.
Wonderful, thank you. Mr. Balfour has it on the telephone.
But I have a question already.
Yes, sir.
If I'm in Williamsburg, Massachusetts, there is such a place because I grew up there. And I download this app. Certainly I'll be able to learn a lot, but a lot of the things for my community are not there.
That is correct. So
But 911 is.
that is correct. So what we're hoping to do is take this to counties and cities across the United States and make this available for them. They would put in their crisis line and their information, but we do want to make it available for everybody. If you did press the crisis hotline button, you would go to our crisis hotline, but obviously you would need help in Massachusetts, not in San Antonio. But we do plan on making this available nationwide. We're going to be taking it to the National Association of Counties and a lot of other national organizations.
We're going to make that available to all the county directors of mental health and substance abuse in the United States. So, and obviously it'll have to be adapted to those counties and their local resources.
Yes, ma'am.
Two quick questions. So this is a Center for Healthcare Services hotline, or is it a?
It is.
Okay.
Yes, ma'am, that is correct.
And how do you download, just real simply, where do I go to download?
You go to the iPhone, to the App Store, and you type in MHU.
Okay.
And we also did a very small website. It's only 3 or 4 pages, but we do have a website at www.mentalhealthu.com, and you can download from that website as well. Yes, yes, ma'am, back in the back?
If somebody in Massachusetts does call the crisis line and it's here in San Antonio, would the people answering that call be able to refer them to someone in Massachusetts?
Yes, ma'am. Yes, ma'am. They would have to do some searching on a website, right. They wouldn't be able to refer to local community resources, but they would be able to refer to somebody in Massachusetts. Yes, ma'am. You had a question? Yes, ma'am? Oh, good. Okay. Anybody else have any other questions? Yes, ma'am.
Is there any probability that app is going to be also sent over to like an Android file?
It will be. Actually, we're working just as soon as we finish here and take a 5-minute breather. We're going to start working on phase 2. That will be Android enabled. We do also we want to make this a little more robust. So what we want to do in phase 2 is we want to have a patient portal. So a tie to something that's how are you feeling today, that helps you manage your medication, that helps you manage your doctor's appointments for people who like to do that on their phones. It'll also have YouTube links to the movies, to movie trailers, so we will be doing that. We don't expect that to be live for probably another 9 months, but we will start working on that soon, and thank you for that question. So yes, we are going to do that. Yes, sir?
Does that website you're just talking about, the website for the one for the clears, is that on the paper here, or do you think that's separate?
I think it is.
It is?
I think it
Would
is.
be on the paper that we get first to come to the door, or the after that?
I think it's on the paper that you got when you first came in the door.
Okay.
Great, thank you. Yes, sir.
I'm looking under suicide, and I'm old, and I can't read it.
Okay,
Can't expand
so
it.
phase 2, we make bigger fonts.
No. Most places you can go, but this particular section of the app, it doesn't.
Can you answer that, Peter?
Yes, the way we actually put it together for the first phase is just to kind of give as much content as possible, and the Zoom feature is a very small little upgrade that we're actually looking into getting it done within the next month or 2. So. Yes, sir.
Great.
Thank you for the.
So Leon Evans just walked back in the door. I want you guys to give him a big round of applause. This was his brainchild.
You recognize Dr. Milo?
I did.
Yes.
I did, yes.
Kind of a thought leader on this.
Leon came to me last summer, right after I got to the center, and said, we want to do this. We want to do this now, and we think it's timely, and we think it's badly needed, and we absolutely agree. We hope you feel the same way, too. Thank you for your innovative leadership, for being such a great president and CEO. We really do appreciate you. If there are no other questions, we'll adjourn. No? Great. Thank you so much for coming.
And be back at 12:45.
And be back at 12:45. Lunch will be served right across the hall. Thank you.